Arthritis Digital Explanation by William Arnold. What is arthritis? Arthritis is a medical condition that affects the musculoskeletal system, specifically joints where two or more bones meet. Arthritic-related problems include pain, stiffness, inflammation, and damage to cartilage and its surrounding structures. This can often result in weakness, instability, and deformities of the joints and structures. Arthritis can affect the most basic daily tasks being performed, such as walking, driving, preparing food, or anything. Today I'm going to give a quick explanation on three forms of arthritis, those being gout, osteoarthritis, and rheumatoid arthritis. Before I go on to discuss the three conditions that I'm referring to with arthritis, I just want to cover the prevalence of arthritis in Australia. As the picture shows, roughly 3.85 million Australians are affected by arthritis, according to the Bureau of Statistics 2007. It costs the Australian healthcare system 23.9 billion each year in medical care and indirect costs such as loss of earnings and loss of production. 18% of the population in Australia, in other words, 1 in 5 Australians, are affected by arthritis. Now, on the next slide, you will see the difference between a normal joint and a joint that's affected by arthritis, specific osteoarthritis and rheumatoid arthritis. As you can see, the swollen inflammation synovial membrane in the rheumatoid arthritic joint, and the osteoarthritic joint is where the damage has occurred to the cartilage and the bones are actually touching each other, and they can cause damage to occur to those bone ends, and degradation of the bone occurs. The first arthritic condition, gout. Gout is commonly characterized by recurrent attacks of extreme pain, swelling, and redness. It affects the big toe joint in the feet and ankles and knees, but it is less commonly in elbows, hands, and other joints. For some people, gout can become excruciating to the point that they cannot even handle a sheet being on their feet at night while they sleep. The causes of gout are: it occurs when uric acid builds up within the bloodstream and deposits urate crystals within the joint. Most commonly caused by under-excretion of uric acid by the kidneys, but it may also be caused by an overproduction of uric acid within the body. Some people already have higher levels of uric acid than others within their blood, but also gout can be caused by taking diuretics as well, such as fluid tablets, which can cause a retention of uric acid within the body. As you can tell by this picture, during a bout of gout, it shows you where the urate crystals are formed, and you can see the inflammation off the side of the big toe there. Bone erosion can occur, and of course that's going to cause excruciating pain in itself when the bone becomes damaged and degraded. But as the picture points out, where the joint itself becomes inflamed during that bout of gout. Now, moving on to osteoarthritis. It is one of the most common forms of arthritis, and it is most likely to develop in people aged over 45 years of age, although it can occur in younger people. Many people will develop symptoms as they age. As we pointed out earlier, osteoarthritis, as you can see by the diagram, it is where the bones are actually rubbing against each other due to cartilage degradation occurring. And this picture, as you can see, when bone erosion occurs, it exposes bone. The meniscus becomes eroded. Cartilage is then eroded, you can end up with bone spurs, and this can cause excruciating pain for the person that suffers it, then restricting joint movement. They don't want to move their joints. A person is going to be in too much pain to conduct regular activities when they are suffering from osteoarthritis. Now, moving on to rheumatoid arthritis. It is a autoimmune disease that causes pain and inflammation of joints. Inflammation causes the joint to become painful and swollen, and movement for the person's joint becomes quite restricted. And inflammations caused by rheumatoid arthritis can result in damage to the joints occurring. Rheumatoid arthritis usually affects people between 35 and 64 years of age. Affects 1% of Australians. And the next picture shows what on the right and the left, the normal bone joint and a rheumatoid arthritic joint, where bone erosion has occurred and inflammation of the synovial membrane, and how that joint has become quite inflamed. Now, this picture shows a person's hands suffering from rheumatoid arthritis. As you can see, the joints, the knuckles and the fingers are quite inflamed and swollen, and the bones themselves are quite deformed. Now, you could imagine how hard it would be to perform daily tasks for a person suffering from it. This picture shows an x-ray of a person on the left with the normal hand, and the person suffering rheumatoid arthritis in the other x-ray. You can see the deformity within the bone joint of the index finger and the thumb joint, how extremely deformed those joints are, and how, as I said, it'd be very hard for a person to perform anything with that condition, and it would be very hard to grab, grip, do anything regarding where you need to use strength within your hands. Now, the causes of rheumatoid arthritis are not yet fully understood. Um, it's an autoimmune disease. Now, the normal role of the body's immune system is to fight off infections. However, when a person has autoimmune disease, the immune system starts attacking the body's healthy tissue. In the case of rheumatoid arthritis, the immune system targets the lining of the joints, causing inflammation and joint damage. This is characterized by swelling, and the joint itself is producing too much synovial fluid, which is a lubricating fluid that helps lubricate the joints and move on against the cartilage. Now, some people are more at risk at developing rheumatoid arthritis due to hereditary factors, but exactly what triggers the body's immune system to attack these joints and cause the rheumatoid arthritis is unknown at this time. Now, we just covered the three types of arthritic conditions I discussed, which gout, the inflammation and uric acid buildup within the big toe causing pain. Rheumatoid arthritis, the swelling of the synovial membranes in the joints causing deformities of the joint, and osteoarthritis, where the degradation of the joint occurs and causes the bones to rub up against each other. I hope this has given you a little more understanding of those three conditions and what causes them. And I thank you for listening to me and taking your time to listen to my explanation on arthritis and those three arthritic conditions. Thank you.